Hi class, I'm Dr. Montero. Today I'm just going to discuss the videos we had to watch this week. So the first video, I observed the Moro reflex being completed. The Moro fleet reflex is a reflex also known as startle reflex. It is caused by a startling stimuli such as a loud noise, bursts of light, or sudden movements. This reflex emerges as early as 25 weeks in utero and is present when the baby is born. This reflex does integrate between the ages of 2 to 6 months. If the Moro reflex is absent in a newborn baby, this may be due to complications such as neurological disorders, an intracranial hemorrhage, an infection, muscular weakness, or spastic cerebral palsy. If the baby only presents the reflex on one side during testing, this may be caused due to a brachial plexus injury, a damaged nerve, or even a broken collarbone. If the reflex does not integrate, it may cause difficulty with sensory processing, balance deficits, and even motion sickness. So to test this, you would lay the baby down in prone. You would have a mat under the baby. So you would support the baby with your upper extremity and your palm supporting the head. So you would tilt the head back into flexion, and when you do that, the upper extremities should extend out in abduction, and then they should come back to midline. Another way you can test this reflex, in case there was complications and you were unable to flex the neck, would be making a loud noise behind the baby, such as a loud clap. In the video of the baby, I believe that this was integrated in this child because the first time that the reflex was done, his arms go out into extension, but the second time he kind of leaves his arms at his chest. So I personally think that this was integrated into this baby. This reflex is important for the proper development of the central nervous system. As the baby matures, so does the nervous system, giving them more control of their motor. So my intervention that I thought of was having the child sit on a bolster swing. This would help the child's vestibular sense that may be impacted from this. This swing also helps the child to improve body awareness, balance, coordination, proximal control, core strength, and motor planning. To make it fun for the kid, you can tell them that we're on a boat and we're going fishing and have a fishing pole in their hand and have them pick up the magnetic fish and then give it to the therapist while crossing midline sitting on the swing. So in video 2, I noticed symmetrical tonic neck reflex, also known as STNR. This reflex emerges between 6 months and integrates around 9 to 11 months of age, which makes sense because this reflex is getting the baby ready to crawl, which is around 6 months, and around 9 to 11 months is when a baby is getting ready to walk. If the reflex is not integrated, the child may show difficulties in crawling, hand-eye coordination, postural control, and can have trouble in the future copying from a board when going to school. This reflex is important because it provides the baby to get into the position to crawl. Crawling is a big milestone, like we learned about in previous courses, was that our arches of our hands are made from crawling and the weight bearing, and when we don't have a good arch in our hand, this can lead to fine motor issues in the future. It is important for the child to distinguish arm and leg movements, separating them, balance, and postural control for sitting upright unsupported. So to test this reflex, you will put the baby in prone. You would flex the neck. When you flex the neck, the lower extremities should extend while the upper extremities would flex, kind of like that. When you extend the neck, the arms will extend while the lower extremities flex. So it's just the opposite. For this intervention, I have to get on the floor really quick to show you guys. I would do cat poses. So I would have the child sit in a relaxed cat, and then we would do an alert cat, which would look like this, and then I would have them scan the room for an object such as playing I Spy. The next video was asymmetrical tonic neck reflex. It is present at 18 weeks in utero and integrates between 5 and 7 months. This is a part of development of muscle tone, one-sided movement with their body, and proper hand-eye coordination. A child that retains this reflex may have trouble with crossing midline, visual tracking, and poor fine and gross motor coordination. If the baby does not have the reflex present, this can be caused by underlying issues in the nervous system or trauma during birth. It can have head trauma, it might be due to an ear infection, and can be due to lack of tummy time. This reflex is important for motor development in the child. This reflex helps develop head control, hand-eye coordination, visual tracking, and crossing midline. To test this, the therapist will turn the baby's head when it is laying in prone. So if you turn the baby's head to the left, this arm will extend, and so will this leg, this lower extremity, while this upper extremity bends. So this is also known as the fencer's reflex because it looks like a fencing position. So for this one, I thought a good activity would just be a balance activity. This could be standing on one leg to throw beanbags into a container. And we can also work on hand-eye coordination because you can throw them in the beanbag and have them catch it and then toss it into the container, or visual tracking because you can take a beanbag and have them look and then reach for the beanbag and then throw it into the container. The last video, I observed the Babinski and plantar reflex. The Babinski, it emerges at birth and is usually integrated by 12 months old, but it is normal for the reflex to be present until 2 years of age. To test this reflex, you will stroke the bottom of the baby's foot, starting from the heel up to the toes, and when you do this, their feet should flare, their toes should flare. So their big toe will kind of extend while their other toes flare out. Plantar reflex emerges around birth and integrates around 12 months. To test this one, you would apply pressure to the sole of the foot and their toes should curl. So if these are not integrated, or if they're retained, a child may have toe walking, decreased coordination, and gross motor skills such as walking. So an activity I thought for this was, again, another balance activity. This time I would have the child on a wobble disc. I would have them on a wobble disc that has different sides for different sensory input, maybe like a flat smooth size, and when you flip it over it has like a little spiky side to give the foot some pressure and some sensory input. And then you can again do the bean bags, or you can put cones with rings and have them put the rings onto the cones, matching the colors, to work on balance and coordination. Again, you can do crossing midline. It's working on the sensory in their feet with the wobble disc. So yeah, thank you guys for watching my video.